for having me. Typically I do talks on various medical subjects, and this is the first time that somebody's actually asked for me to talk about me. So thank you for that, Cornelius. So when I describe myself, people know me to be an innovator and to devise complex systems, and really it's all out of the sake of laziness. And I don't mean laziness. I say with the fact that I like to work smart, and I build systems that are automated and that feed on each other. Is anybody familiar with the book Cheaper by the Dozen? That guy was my hero growing up, and so I've always had this idea of how to do things more efficiently. So like you said, I went to Bel Air High School, go-karts, and A&M, and so I'm kind of a local guy. For 20 years, I ran a full-scale family medicine clinic because I love everything. I love all the conditions. I love all the ages. I love everything. But about 12 years ago, a couple of things started happening. I started seeing the baby boomers were hitting this magical age where they were leaving the workforce, and they were starting to develop dementia, and there was things starting to happen. And I used to take care of a few families that were locally just to do them a favor and follow them into the nursing home. And the more that I went, the more that I saw there was a need. And I'm one that I live by grace. I don't know what your beliefs are, but I know I don't do things my way. I do things the way that one tells me to do them. And so I kept getting called in that direction. And the more I did things, the more I saw that it needed to be done. And so I kind of gravitated in that direction little by little. And about 6 years ago, I built a geriatrics team that was separate from the clinic, that was dedicated to senior living, because I quickly found, not only is healthcare fragmented, over and over I see, miscommunication and waste and all kinds of messes. But with senior living, it's not a simple doctor-patient relationship. It's doctor, family, hospitalist, specialist, home health, hospice, patient relationship. It's many layers of complexity. And so running a very busy, big clinic, and living in two worlds, it made me really appreciate the very stark differences of clinic versus senior living. And so with that idea, in 2020, I sold my clinic to a corporation with two things in mind. One thing was I wanted to see how far up the corporate ladder I'd make it, and the other thing was I said one day when I grow up, I'm going to focus only on seniors because that's where my heart is. And so also in 2020, what else happened? Well, pandemic. So when I joined the corporation, I quickly went up the ladder, and they put me as the chief medical officer of technology and developing their national telemedicine platform. And I kind of consider myself the youngest of the old doctors, or the oldest of the young doctors. In that when I was in medical school, I was one of the first ones I had a Palm Pilot, and I was one of the first medical students that didn't have books stuffed in my jacket. I physically scanned books into a Palm Pilot format and had them in this, and that was the coolest thing around because I would pull up my little computer. And when EHRs were coming out in the 90s, even though I was a little medical student or a little resident, the big specialist and faculty would come to me for advice on how to figure out how to work with these computers. If you recall, when they first came out, they were awful. They were designed by computer engineers who have no idea about people or medicine or how things workflow, and it was nightmarish. So I always kind of stayed into that and stayed ahead of everybody.
I'm sorry, what's an EHR? I hate to be basic.
Electronic health record, electronic medical record. I'm sorry. They kind of changed the terms around one way or the other.
I think they call them EMRs to me. EMR.
Yeah. So I'm sorry. So I spent time, working with those and developing those. So back to pandemic. So 3 years before pandemic, I saw the brilliance of telehealth and the idea of bringing care through technology. At that time, again, that software was very rudimentary, difficult to use, and at that time, nobody understood how that would work, and the software connectivity wasn't very good. But I was looking into that and developing it, and actually in my clinic, 2 years before pandemic, my patients were already kind of used to it and doing it. So when pandemic came around, again, I was working with geriatrics and the clinic. And as a microbiology major in college, I knew it was coming, and I was impressed with myself that I had PPE from Amazon before everybody else. I had everybody, kind of prepared. Here it comes, here it comes. And then when it hit the rodeo and we said, oh crap, here it is in Houston, I snapped my fingers and we flipped everything into telemedicine. Our clinic instantly went into telemedicine. All of our staff went home, and we had all the workflow going. So for us, it was no big deal. And for our senior living, I'm so proud of my staff because, part of training them, they were able to train 70 facilities within a week. And because for a while we tried to introduce it and people were just like, and the way I talk about telemedicine being introduced in the pandemic is like we were all thrown in the water and we had to learn how to swim. But we did a good job with the people we work with, and so we were ready for it. We flipped into it. And I went into it thinking I'm gonna be the boss of this pandemic. Well, at the same time, my wife, does anybody know the show Bar Rescue?
Yes.
With Darn Tapper?
Pretty cool.
My wife does that for doctors. So she goes around teaching doctors how to fix their businesses, and so there were some clinics that were not so sophisticated and didn't quite understand what was coming. And one day she came home and then she got sick, and of course I got sick. And I got sick very badly, and I spent a big chunk of April in the hospital. I spent all of May on high dose oxygen. I had the long haul stuff, and I physically could not function in clinic. I would try, my brain would say, you're gonna do it, and my voice would break up, my chest would burn, and it was just physically, I was weak for months and months. And I said, you know what? There's been a lot of sadness, a lot of loss. The doctor that saved my life ended up passing away. I signed way too many death certificates, but there were a couple of very positive things that came from the pandemic. Number one, it forced me to realize, you know what? My titles and my status on the ladder doesn't matter. My health and my relationships with my family are what matters. And taking care of the people in front of me are what matters. And physically, the fact that I couldn't function in the clinic, it said, you know what? I guess this is my time. I was going to be a couple of years from now, but this is my time. I'm going to focus on the seniors. And so I was developing a telemedicine platform on top of all of this because I saw the lack of sophistication. So I was working on that at the same time as all this other stuff. And while I got sick, all these other companies came in with their telemedicine, and it was offered for free. And so by the time I got to where I could think about it, I said, everybody's doing it for free. I'm not going to worry about it. So I shut that down, but I had all this knowledge and skills. And so at the same time, I finished my MBA program, and I learned all kinds of new systems of Lean Six Sigma, yellow belt, green belt, and new ways of building efficiency. And so I put all of that experience and all that knowledge and put it all into my seniors. And so at this point, we do some really cool stuff. So that's kind of my background of how I got here. So I'm not going to give all my recipes of how I do things, but I'm going to give some of the main ingredients. And for us, it comes down to two things, which are technology and relationships. And when it comes to relationships, it's very simple. I do the right thing for the right reason. I give more than I take. And by giving and taking, I'm not talking about money. I give good karma. I help people get from here to there, and I make sure whatever situation I'm in is a win-win situation. So for me, it's easy. I'm not moved by money, and I actually care about the people I take care of, and I'm constantly focused on what's the right way to do things, what's the best for this person. And as a family doctor, I consider the whole family dynamics, not just the patient, but all the dynamics around the family. And for me, the hospice and home health and everybody else's family, me too. So those relationships are very special to me. And And because of that, I have a good time doing what I do. So again, with the fact that healthcare is very fragmented, the electronic medical records, when they came about, they were built to be little islands, meaning each software brand had its own software and they were protecting their copyrights, and they grew up as little protective islands, and this hospital had this information and that hospital had that information and this doctor had this information. So everybody was all these islands, and they were built to not talk to each other. And then what happened is all these electronic records generated data. So we're creating millions of visits and millions of patients and all this data. And then in the early 2000s, we started looking at the data, and we came up with data analytics. And that was this, oh my God, moment of there is so much fraud and there is so much waste and so much badly organized resources. And there was a report that came out about 1.5 years ago that said 1 out of every 4 healthcare dollars is waste, completely wasted, that didn't have to be spent. And because I dealt with some big national, federal level people, they said it's actually more like 1 out of every 2 healthcare dollars is waste. And for me, that drives me nuts, you know, the fact that there's waste in disorganization. And so a lot of that has to do with miscommunication and bad systems. And so what I've done is, while things are getting figured out, and they actually are, it was announced because of all the other pandemic stuff, but along the way there were some federal initiatives that were made that say there needs to be interoperability, which means you need to talk to each other. These systems are being forced to talk to each other. But it's not just a matter of programming software, it takes physical effort by real people connecting all the dots and making all these systems talk to each other. So it's going to take some time for all these things to happen, but they are in the process, so help is on the way. But what we do is I have privileges at every single hospital system in the area. So I have access to all the records everywhere, just my team. I have people in place that connect to those systems and they're logging in, so when somebody goes to the hospital, we're following them as they go in. I have the reputation and the respect that I can call the doctor that's there and say, hey, what's going on? What do we need to do to have things safe? Because if you work at facilities, you send a patient out, they come back with a pile of papers, 50 papers saying, quit smoking. If you're pregnant, we're dealing with 9-year-olds, but there's all this paperwork that's completely useless. And the facility staff, I'm looking at Lisa, the facility staff gets beat up by the family saying, what happened with my mom? What are we gonna do? Because people are stressed out for their family. And when you get this big pile of papers, they're like, well, they got an antibiotic and they're supposed to follow up in 2 weeks with somebody. But I can actually get to those systems. I can understand what's going on. I can connect with the doctors and put things in place where there's already a good plan. We already have things in place. Part of what else I do is, because I'm hospice board certified, when I meet a new patient, nice to meet you, what are your directives? And so I right away open that conversation and keep it open about, what is this person's values? What are their goals? And so when episodes happen and there's changes of status, we bring up the conversation, and people may not decide right now, but the fact that the conversation's happening and it's open, and there gets to be a time where going to the hospital is not fixing things, going to the hospital creates more stress than it fixed, and then that conversation that's difficult isn't as difficult. Another thing that our organization has is a family hotline. So I have staff members that their only job is answering calls to families. As we learned in pandemic, everybody was disconnected, we're all quarantined. And so by having that in place, it just helped ease some of the suffering. I wouldn't say eliminate it, was just a lot of suffering. I would say I signed a lot of death certificates, and half of them were virus and the other half were people that declined from lack of social interaction with their families. So, and I hope we've learned from all this that, we've got to figure things out, but we cannot disconnect our elderly from their loved ones. Hopefully that will never happen again, no matter what. But, again, it was a lose-lose situation. So, but we have a family hotline, and We're constantly connected to families before we go to a visit. The week before, we're calling the family saying, do you have any questions? Do you have any concerns? Because the family's going to be aware of stuff that we're not aware of. And we develop a plan based on what works for everybody. So we have mobile lab, we have mobile radiology that works 7 days a week. We organize all these things. We have relationships with Dispatch Health, which is a mobile urgent care. They can get IV fluids and IV antibiotics and instant labs, that another way of keeping people out of the hospital. So we're constantly engaging different resources. I got a letter from the insurance last week. I actually have it here with me if you can see it. It was kind of threatening me, saying, you're overusing code such and such. Well, code such and such is a code that says, if you see somebody within 7 days of a hospitalization, you bill for this code. That code won't get paid if the person goes back to the hospital within 30 days. And they say, you're using this code more than all your other peers by a long shot. And I said, well, you're welcome and thank you. Because it proves that my team is more organized. We put things in place. So most of the better organizations of healthcare, they have like a 70 to 80% 7-day follow-up within transitions of care. 78% is like great. My team was like 95%. Once you get out of the hospital, we're pouncing and getting things in place. Because we're following them in the hospital, as soon as they get out, we're pouncing on them. And sometimes it's through telehealth. Sometimes that's the easiest way to get to people. But the fact is, we review the information, we reconcile medications, we trigger resources real quick. And if they need to see a specialist, I know a whole bunch of specialists. I can call them and say, hey, we need to get you in with so-and-so sooner than later to make sure things, stay stable. My team uses artificial intelligence. So when you text our team line, you're texting our whole team. We're all watching it, and simple questions will be responded to by a little robot that says, well, we're open such and such hours, and certain simple questions are automatically responded to, so there's a constant quick response. And every member of our team is looking at it so the right person answers the right question faster than otherwise. So we have that working, and I kind of helped develop some of that artificial intelligence software and work with the developers of that. My team is trained based on interdisciplinary relationships. What does that mean? It means everybody on my team knows what everybody else is doing. They know how to do everybody's job. And this is something everybody can take away. And we don't have boundaries of our roles. So if so-and-so's doing their job and they see somebody struggling, they just go out and help them, and they help them figure it out. And if we have a team member that's out for whatever reason, we don't hesitate. Somebody else jumps in and figures it out. So there's this, actual hive mentality that we're always working together, we're always helping each other. And the fact is, we deal with a lot of sadness and death and end of life and tough stuff. But my team is always enthusiastic. They're always full of energy. And why is that? Because we're all working together. We're all helping each other out. And we know when we're doing our job right, we're making a big difference. Families are aware that they know that they got the best options, they got the best treatments. We were able to improve their quality of life, whatever that was, compared to somebody that's not working with us. So they're always constantly enthusiastic. We use location-based software, so we have a guy, his only job is he's a dispatch technician, like an air traffic controller, and he's watching the providers as they move around, or me as I'm moving around. And when an issue pops up, he'll say, oh, so-and-so, you're over there, go see this person. Or, hey, we can't get there, let's do telemedicine. So we're just constantly leveraging technology and knowledge and getting stuff done. And we have a good time doing it. What else? So at this point, we're at about 100 different senior living facilities over most of Houston. Actually, yesterday I was in Stephenville, and we're moving out, and so we're built to leverage upwards. The telemedicine is still important. COVID is still a thing, and we realized when it comes to the most fragile, delicate, oldest people, you may be boosted and vaxxed and all that, but the virus comes around and it'll still take you out. So it's still a real thing, and because of that, if we have a provider test positive, they stay home and we don't stop moving. We're doing the telemedicine, so just everything keeps on happening. And we were built to be agile, and we were built before that through the pandemic, and the pandemic just made us better and stronger for it. It was another positive for pandemic. Again, there's this resentment of telemedicine of like, oh, I hate the video visits, we all want to be together and see each other. That I think we all appreciate that a whole lot more than we used to. Just the fact that we can be in the same room and open our faces up mostly. But there's also some clear value to telehealth. Ideally is being in person, but telemedicine is better than going to the hospital and letting bad stuff happen. Telemedicine allows us to leverage higher level of knowledge sometimes. I had a guy a few weeks ago. He's blind, he has advanced Parkinson's, he has no family. I was visiting him and I was like, and he was in independent living. He had a couple of neighbors that were trying to help him out, and I saw this is bad stuff coming. He is not stable, he can't even stand up on his own. He's heading for the hospital soon. So it would take months to get to a neurologist, and even if we got that visit, getting this guy to the office is an immense challenge, taking a whole bunch of different people, making stuff happen. Well, I called up my neurologist buddy who's a movement specialist, and I said, hey, do you got a moment for a video visit? And he knows me, and he's part of this network that I work with, and so they know my people are priority. And so he said, okay, give me a minute. And within 5 minutes, we had a super specialist making decisions about medications. He said, here's plan A, here's plan B, here's what we're gonna do. And then I put it in place, and boom, we just got higher level of care from a subspecialist. So we can do all kinds of cool stuff that wasn't possible before. And as far as I know, there's nobody else that does what we do. So because I've been around for so long, and believe it or not, I don't talk much. But people know I talk through my actions. I perform, I get stuff done. And when I talk, they know there's a reason for it. And if I ask for help, they know I'm not just being, a diva or, asking for special. So when I call on specialists, I say, I have a patient who's complex, who needs a little extra effort, needs a little extra work, a little extra communication. But they already know I've trained them all how to work with telemedicine and how to work with senior living people that have mobility challenges. So I have access to this network of doctors that I'm actually rolling out in a kind of a different level, and it's not a big legal financial thing. It's just a group of people that are like-minded, that have this understanding of we're going to get care to people that have trouble getting to it. And that's something that we're developing and we're rolling out and growing bigger with. And so that's part of the reason I'm here, is I'm starting to get the word out about that, because I know we're getting really good care to people that otherwise wouldn't have. Yes, ma'am.
So I just have a quick question.
Mm-hmm.
Having worked in a community for a long time and familiar with, just healthcare in general, with Medicare Advantage plans, with Medicare, with different plans that people are on, like Healthy Care Advantage. So if people have primary care physicians or PCPs that they're currently working with, how do you coordinate with that, and how would people access you when they're used to seeing ABC doc for this, and this?
Cut me off. You're like 3 lines ahead of me. You're asking a question that's exactly that's an important thing. So as a family doctor that's been around for 20 years, and I've seen, taking care of the patients and their kids and their grandkids and their neighbors, that relationship with the primary care is very special. But as a primary care that really cares about my patients and really wants the best for them, I know I'm stuck in clinic and I have a hard time putting attention and working things around them. So I'm also getting the word out to primary care doctors saying, hey, you're going to be making the right decision for your family member, having me on board, building care all around them. And so I kind of adapt to, there's different doctors. Some of them want to be included in the decision making. Some of them will go to the nursing homes or assisted living from time to time. But doing that heavy lifting of the day-to-day orders and calling with families and dealing with it, that's impossible for a clinic doctor. So depending on their level of interest and ability, we'll engage with that doctor and take care of their patients as I call it, I'm the quarterback, and they're the star wide receiver or whatever. So we're getting care to them, and we're not replacing their doctor, but we're doing all the tough stuff. And so when the doctor has time and ability, they can still connect with that doctor. The only kind of caveat to that is some of these Advantage plans. Advantage plans, they're HMOs, and they're very controlling, and you have to have one primary care doctor. And if you want me to be in charge, it has to be me as the primary care doctor, and they block out the other doctor. So that makes it a little bit more difficult to kind of do both. But typically, once families know that they're dealing with somebody who's competent and actually cares, they're happy also, and the doctor's happy knowing that their patient's in good hands. So if they have regular Medicare with the supplement, we can do both, and whatever works for you, we can be flexible. So Advantage plans are, you have to be me or them. But again, when families have to take off work and they're taking care of their own kids and their own, just getting mom to the doctor's office, and chances are she's getting stressed out sitting for 2 hours, and just the whole process is very stressful to everybody. So over time you realize having a doctor that brings all this stuff to them is just, good for everybody. So, let's see. So we were talking about telemedicine advantages, but there's still the limits of telemedicine of, you can do telemedicine, but you can't listen to the heart, you can't listen to the lungs, you can't look in the ears, until now. So, with the idea of the old-fashioned doctor here, who's also a tech guru, I'm the first doctor of any kind in Texas to have this Nonagon device, and this is a device that has a built-in stethoscope, so you can listen to the heart and lungs, abdomen. It's got a built-in otoscope, so you can look in the ears. It's got a pulse oximeter and a thermometer, so you can gather all this information. It's got an app that connects to the phone, and it's a strange concept, just like telemedicine was, but the app will guide the person. Okay, put it here, put it here, put it here. Oh, do it again over here, and it guides them, and then it sends the visit up into the cloud. Then the doctor gets a message, hey, you've got a visit pending. We grab it down from the cloud, and I listen to the visit, I look through the things, and then I'll connect to the people, and we can do it live. I can say, okay, put it over here, and so we can complete information, and actually I can save that visit and share it with the specialist. So I can have the cardiologist listen to the heart and the murmur, and the lung doctor listen to the lungs. So we can share those things and just kind of get information moving in all these directions. So again, we're multiplying care, we're getting good stuff done. For good reason. So that's a unique thing, and it only costs about $100. So later in the year it's going to be direct to customer offerings, and the biggest challenge is getting doctors to say, okay, I'm going to give that a try. I already did the telemedicine, oh god, let's do the next thing. But again, once we realize we can get better care to people, I think it's a beautiful thing for pediatricians. Usually pediatrician is like, I guess I'll call it a Z-Pack, because the ear hurts. Well, you can actually look in here and you can say, no, that's actually allergies, and you can give good information about, well, here's plan A, here's plan B, don't go to the ER, here's, we can save a whole lot of money, and we can save a lot of stress and a lot of suffering by using technology like this.
What did you say the cost was?
It's about $100.
Wow.
It's very affordable. These kind of things, they didn't work that well a few years ago, and they were like $600, $700. So they just really, just time and technology improves things.
Okay, so I want to put it out there. How do you get the families buy-in? Because, in skilled nursing, we've known each other for a very long time. In this skilled nursing environment, people always think that they have to see a doctor or they have to actually be there 24/7 to make the right choices, or the ER or the clinic, which during the pandemic, it was interesting for me because I felt like people gave me the autonomy to be able to work with a physician, take care of the patient, do the IVs, do the TPN, do everything I needed to do, and there was no questions from the family. Because we were all in that pandemic situation, which I got more accomplished because of that. And I think all of us can say that from either home or in independent living or assisted living. where we have more autonomy with our physicians and extended care teams to be able to get those done. How do we get out of this post-COVID stress environment to be able to get families to buy into that type of listening and not bringing them to the ER every time you turn around again?
Some of it is just developing new good habits and working with physicians that have family hotlines that'll take care of a lot of those things, and me going out and giving talks about this little swanky device. And just, you know, as people realize it's an option and not just an idea, but it's a reality, and we can actually save a whole, you know, and again, most people would rather be in person, and I will agree with them. I love to be in person. I love to feel the thing. I love giving people hugs. That's ideal, but the reality is the alternative is going to the ER or wait until bad things happen or calling in prescriptions that may or may not be the right thing. So once people get to the idea that, you know what, yes, there's plan A for this situation, but this is actually a better option for this situation. And it's just kind of building new habits for doctors too, to kind of realize this is something good. It's not strange, it's not weird, it actually saves me time. I can make better decisions more accurately. So just getting to the idea of a new, better way of providing care. Speaking of better way, yes sir?
Backing up from the microcosm that you're dealing with your clinic and your people and your management of that system, how do we spread that across the country?
It takes time. Maybe it's marketing. I'm working with the company and I don't make any money off of it. I just like helping people do cool stuff. But just, you know, getting the word out. I speak to doctors, I speak to hospitals, and just because I think this is going to
I'm not talking about just a piece of hardware. I'm talking about the whole concept that you've got with your clinic and your people and your coordination. That relies heavily on you at this point.
correct.
I'm curious on how we can get that to be in Dallas, how we get it in New York City, how do we get it in Los Angeles, how do we get it across the world?
So I've spent most of, again, early pandemic, we were all in survival mode. For the last year, I was looking at the end of the pandemic and saying, you know what I do is really cool and really different and very special, and nobody else is doing it. And so I spent a lot of the last year kind of building the blueprints of how to scale on other areas and other ways and get this idea out to other people. So I actually have that ability to share on a bigger level and teach other people things, and probably will do that. But it takes a lot of someone like me that understands complexity and also demands respect. Doctors will listen to me. That's some of the problem with some of the technology stuff is, doctors are busy. But I know how to talk to doctors, and I know how to talk to patients. I've been on the front lines for 20 years. I know how that is. So I have that kind of cross boundary of dealing with different peoples, and I'm happy to get the word out with other people. But that's what it takes to get it out there. Yeah. Because you see, publicly traded corporations saying, I'm going to go in and do stuff. Nobody believes it, and you need to earn respect. You need to earn trust. You need to earn cooperation, and that's what telemedicine didn't get adopted for many, many years before pandemic, because everybody's like, I want to do what I did yesterday. I don't want to, invest in another crappy EMR or another, it takes time to learn stuff. It takes time to get stuff in motion. It takes money to do all this, and people are busy and stressed out and, averse to things failing. So you need to come to these new places with success and with clear plans of where I'm going to do A, B, C, and D. When this happens, I'm going to do this. So all these things are possible, and they'll be coming pretty soon all over the place, I hope.
Are your services primarily distributed through the senior care centers?
Only.
Only?
Yeah.
Okay, so if you're not a resident in a senior community?
Correct. Yeah, I don't go to houses. I don't do non-senior living people. And I chose that as this is what I do, and I'm the best at it, right, in my opinion.
Right.
But I keep my focus on that.
Can you talk about medical marijuana, being used for?
It's right ahead of me.
Okay.
So I was leveraging. No, it's all good. Leveraging from new ways to provide superior services and superior care. and quality of life, and that's what I do. Living in the hospice world and the hospice environment, I was introduced to medical marijuana, which is a new thing in Texas and a new idea everywhere. And it's kind of like there's this massive, more than telehealth and all that, this lack of information from doctors and patients about what is medical marijuana. People are either raw, legalize it everywhere, recreational, you name it, let it loose, or ooh, it's the devil's cabbage, it should be illegal and it's a shame. And I am anti-recreational drug abuse. I've got teenagers and young adults, and we have these battles about, choices and consequences. And I've seen plenty of badness and stupidity. So I'm a very disciplined doctor. I like good knowledge. I like guidelines. I like research. But I was faced with the concept of there's patients with advanced dementia that are in a state of fear and anger and sadness and agitation. And I can prescribe all kinds of different medicines. I've been doing it for 20 years. I've got good training and I know how to write prescriptions. I work with specialists, but there are people that were just suffering, and it was either angry, agitated, or we turn them into a zombie, and there's no quality of life. And so it was the idea with these people that I looked into this option, and I said, well, show me the good research, show me the studies. And I read about 4 different textbooks that were the best I could find at it. I'm very disciplined, I'm very educated. I looked at lots and lots of research, and I watched 100 hours of video webinars about, what the chemicals and the receptors and all these things are, because I really want to know what is it. And what I found was there wasn't a whole lot of good research and not a whole lot of good evidence. Why? Because the legal boundaries, the stigmas of it, there's just not a lot of large, good studies. They're actually happening now, but it's going to be a few years from now that they happen. But with all this lack of good evidence, I found it very, very, very consistently safety. Even over-the-counter substances, there's a certain amount you can kill an animal with it. And they tried to kill animals with the chemicals in it, and they couldn't. They'd give monkeys 5,000 times the dose that was recommended, and they couldn't kill a monkey. They'd act funny, but it's safe. And so I said, well, and these people with no hope and no options, let's give it a try. And I found success and success and success. I found people to be more calm, more alert, more cooperative, and at this point, almost every week, if not every 2 weeks, I see little miracles. I have families coming to me crying. I had a lady that was kicked out of Louisiana. Everywhere she went, if you didn't fit her reality, she would attack. She was very physically fit, but she was living in a whole different reality. She thought she was in an office in the 1950s and nobody was doing their job, and she needed to get them straight. And anytime you were a new person or doing something different than usual, she would physically attack. And so she got kicked out of 12 different places in Louisiana. She came to me, and the first time I met her, she was in my face threatening, and I know how to engage people and calm them down, but she was clearly like looking for a fight. And so we started her on it, and about 2 weeks later, she was still really busy, but she walked by a guy fixing the carpet, and she came back around, and the daughter's like, she didn't attack. That's an improvement, because usually she would attack. And then after a month, she came to me crying and said, I was able to sit down for 2 hours with my mom, and she's still living in a different reality, but she was talkative and pleasant and was able to sit down and have a good time. That's a huge, I've got my mom back kind of thing. 2 months later, she came to me crying again and said, we're moving back to Louisiana. She was able to calm down enough to remember where she put her will, and I was able to get legal authority over her again and get things straight. I mean, she gave me directions, go to my office, go in the middle drawer, and she was able to calm down enough to get back into reality and get things in place. And I have the picture here somewhere. There's a picture of her around her grandkids smiling. And for me, that's in the category of small miracle. And that's not the only one. I mean, there's a lot. There's a lady that was scaling over fences and beating people up and running down the street and attacking, and same thing is, just able to calm down. It helps this energy saying something's wrong, something's wrong, something's wrong, something's wrong. And for me, now I have a few hundred people under therapy, and it's not alternative medicine to me. It is superior treatment to me. When it comes to sundowning behavior, and whenever we're thinking, antipsychotics and benzos and opiates, for me, I think about why not start this first. And it is different. It's not covered by insurance. It doesn't go to a pharmacy, it goes to a dispensary. So there's a little bit of, getting used to a different thing. But I'd say probably 98% of people feel some improvement of quality of life. Caretakers say, hey, we're able to give baths easier. We're able to sit down and eat easier. It helps with sleep quality. There's a lot of day and night confusion, and this helps with that. It helps a little bit with appetite, not as much as you'd think it would. But it makes a clear difference in quality of life. And when you're getting to people that are in constant suffering and constant stress, it's worth it. And so I go around and I have a lot of success with that. And when people have kind of this misinformation, the way I present it is, I'll say, well, you see kids at a college party, with a kegger, and you look at them and they're trying to get wasted, okay? You look at people having a nice dinner at a fine restaurant, drinking a fine glass of wine, it's the same chemical, but we perceive it very differently. For the college kids, the intent is to abuse and to get wasted. With a fine meal, it's a complement to the rest of the treatment, the rest of the evening, and that's how I perform and how I include it into therapy as a complement to the rest of it.
Are these edible? Is it edible?
Yeah, smoking is not allowed in Texas yet, and I think Texas is doing a really good job of saying, hey, we're gonna give access to it, and y'all better do it right. And then about a year later, they said, we're going to give access to a few more people. They gave access, it used to be end-stage cancer, now it's any cancer. And it used to be like certain things, and now they're allowing PTSD. So Texas is saying, if you do it right, and you prove that you're doing it right, we're going to give a little bit more access to it. A little bit higher concentrations. And there's still a lot of people in this world that are looking to have fun and do it the wrong way and party. And so I respect Texas a lot for saying, we're going to make sure you do it right and get it to the right people for the right reasons. I see plenty of useless people doing useless things for no good reason because they're playing around with that stuff. And, I don't think it should be open access to everybody. But, there's plenty of people abusing alcohol, so.
Are you doing research with your patients so that we will have more evidence-based?
Yeah, and I have forms that are built. We have people do surveys about their dementia behaviors and quality of life and certain things. And actually we're quantifying, we're able to reduce these medicines, and those medicines cost this much money. So over time, I'm one person and we have a certain number of people. You need really good numbers and more stuff.
That's what I was going to say, is I just came back from our National Care Manager Conference, and this was a topic that was discussed. And there's just very little known about it at this point, and everybody's really interested to see more data. And if you'll get out and do more talks like this, that would be great.
Yeah, and I'm one that people listen to because I am not rah-rah drugs. I am not rah-rah weed. You don't see me, with tie-dye and I'm very disciplined. I'm very disciplined, very educated. I come with authority and I come with knowledge, and I will talk, scientific data. Again, I don't see myself as someone to, spread the word about weed. But on the other hand, I think that one up there said, you know what? You're particularly skilled and particularly aware of this vulnerable population, and we really need to get it out to them more. And so that's what I'm doing.
Is your application primarily in the dementia world?
So I actually have a separate company called TH Clinicians, and so I do consulting for people with cancer, with neuropathies, and non-geriatrics people. But to get to me, you have to have seen doctors and gone through traditional treatments, and I'm going to review the medical records to make sure. Because when they first opened PTSD, there's a whole bunch of millennials, I've got PTSD, I got a bad score on my game.
Yeah.
So I make sure I get to the right people and they get to me.
Yeah, because
So
when you're referencing behaviors, that's immediately what I think
yeah.
of, so.
So
managing-
my world is geriatrics and senior living, but I'm comfortable prescribing to certain people and, you know, all ages. You know, I have experience with all that. Autism's another thing, and there's some people who say, hey, I'm autistic. But there are people that have severe autism that have real struggles with anger and agitation, and it's really a nice chemical for them. It allows this extra, you know, things are wrong. It calms that down. There's teachers that are getting attacked less.
Yes.
You know, less seizures, and I'm very careful with seizure. It's indicated for that, but I'll work closely with the neurologist. You know, about somebody recently said, well, I'm going out of state. We're going on a cruise. Can I take it? Like, you know what? Don't cross state lines with it. It may be legal in Texas, but your employer may have their own policies, and other states have different policies, and federally it's still illegal. That's a whole nother, you know, matzo ball hanging over us.
Right.
It's federally illegal, you know, but again, and it's not covered by malpractice for doctors, so I'm vulnerable to this, but I feel I'm very educated, and I do stuff I can clearly defend what I do and how I do it and why. So I feel comfortable doing it, but that's why a lot of doctors aren't quick to adopt it also, is because you're vulnerable.
Do you have
You know.
any recommendations on resources for dispensaries that are trustworthy? I think that's the other thing that a lot of people are concerned about, is the consistency and knowing what you're getting.
Yeah.
So that's a good question too. That's a whole nother, I can do a whole nother talk. So basically, there's a lot of Delta 8 that's available at your local gas station, and there are CBD dispensaries and all that stuff. And there's a huge variety of quality, and that's just a whole nother conversation. Through my program, it's a state registered program, and so there's essentially 2 dispensaries in Texas that are allowed to do it, and they have a very, very high level of scrutiny by the state and all kinds of stuff. So when I prescribe something, I know that they're gonna get exactly that. And that's the difference. You know, I'll tell people the gas station stuff's probably gonna act about the same kind of, but the cannabis plant's very absorbative, and it can absorb pesticides and heavy metals and all kinds of stuff. And, you know, if I'm dealing with, you know, 99-year-olds and cancer patients, I can't take that chance on, you know, probably it's this much or probably this much. And I have patients that say, I'm suffering, but I'm afraid because I did it in college and I felt really weird, is because probably what you got was really way too strong, and there was unpredictable doses, and, you know, you were drinking a big shot of something that you didn't know what it was. And, you know, I prescribed the fine wine in a little glass. So that's a big, you know, information gap that we have to cross.
Is the dispensary out of Austin?
Both of them are around San Marcos area. Good Blend and Texas Original are the main 2. So what happens is I do a consultation, I send a prescription to the state registry, and then one of the dispensaries will access that registry and say, Dr. Valdez prescribed. It's usually gummies or tincture are the 2 forms that we commonly use. Gummies are easier for most people to count if you're at a facility. Tincture is better for people that can't swallow and really need to fine tune the doses and things like that. So those are the kind of the 2. There's a few other forms, but those are the 2 that I usually work with, is those gummies and tincture.
So are your consulting services available to non-facility?
Yep. There's if you go to thclinicians.com, it kind of reviews what are the current approved conditions, and again, the main confusion is people say, I have anxiety, I have depression. It's only PTSD in Texas at this moment. Probably that will change later on, but it has to be labeled with PTSD, you know, by a specialist and proven. And it's not approved for chronic pain. It's approved for neuropathy. So a lot of people with pain problems have neuropathy, by the way. But if you have only bone pain and you're only taking opiates and no neuropathic things, and you haven't been diagnosed with neuropathy, sorry, can't help you. But it's extremely effective for migraines. And so I have a lot of neurologists send me people that have a qualifying condition and also migraines. And so when I do those data forms, I capture that information. There's like Crohn's disease and certain other conditions that it really is a lot safer, more affordable, and better in every way than the prescription stuff. But it's not approved in Texas yet. So over time, as we get better knowledge about, yes, you're taking it for this condition, by the way, it's helping with this and this and this and this, then we'll present that to Austin and say, hey, Mr. Governor, Mr. Legislators, let's approve it for other stuff. I mean, at some point I'll go and talk to those guys about it, once I get more information.
So, for someone who doesn't have PTSD, but he's studying, so we're talking knees here.
Okay.
Terrible knees, terrible back. Okay, so I started taking CBD gummies, okay? I took one brand, the non-THC ones, the ones that are just have the hemp in it, okay? My doctor is like, he just cannot believe, I totally have no more pain. No, seriously, I mean,
Yeah.
if I saw an orthopod would have me on the table in a minute. But I've been taking the gummies, so my question to you is, for the non-THC type, because I work full-time and I take them, what about the quality of those? I mean, you can order them on Amazon, you can order them anywhere. And so is there any way for someone like myself or anyone else in this room that might have some pain issues to know about what you're actually buying quality-wise, and if that will actually have any
You have
benefit for
the
you?
best questions. Yes, there is a way, but it's actually kind of a long answer. But the short story is there's something called third party lab testing, which means the company that produces the substance sends it up to a lab that theoretically is not associated with them. That lab will verify, and there's a report that comes out that says, here's the test for pesticides, heavy metals, solvents, purity, bacteria, fungus, And so it's a third-party lab testing that will be given. Now there's companies that say, I know people are going to ask about that, so I'm going to come up with a pretend one. So you have to really know what you're looking for and know how to verify. Don't be afraid to call that third-party lab and say, did this lab company actually send this specimen to me?
So we would have to look to see, because someone said to me, are you sure the one you're taking doesn't have metals in it?
Who knows?
I don't know what it has.
Who knows?
I have totally no
That goes with
idea.
over-the-counter supplements
So
too.
if we're looking at a brand, like we see on Amazon, then what you're telling me is I should go to Google and look up that company and then look up to see if they have a third party?
Yeah, that company will say it, and if you want it, you could do it yourself and send it to a third-party lab. It costs probably about $100, $200. But if you really wanted to know, do I trust this company, you could do it too. But the more reputable companies will do that, and there's a cost involved in doing all that extra stuff. And typically the over-the-counter costs about as much as the stuff that I prescribe. But you're talking about CBD and I'm talking about actually both, which is a whole nother conversation.
Right.
So the plant has two main chemicals. There's a whole bunch more, but there's THC and there's CBD. And actually the prescription stuff I use kind of uses both. And the way I explain it is one's kind of like a guitar and one's a drum, and I prescribe the whole band. So you're getting, the drum section, and that helps specifically with pain. For certain types of pain, it helps really well. So CBD is really good for bone pain, whereas THC is not. THC is more for the sleep quality, anxiety, mood stuff, and it gets really complicated, but that's kind of the bottom line is they do different things for different reasons and they work better together. So you're doing one thing that helps for your issue and good for you, and you can tell, I feel a difference.
Right.
Perfect.
What about Parkinson's? It's not available for Parkinson's?
It's indicated, what I do is indicated for Parkinson's, and most of the prescription Texas program has to do with neurological stuff.
Right.
So anything neurologic, chances are there's a big long list, and you can see it on my website of the conditions, ALS, multiple sclerosis, there's a whole bunch of things that it really does a good job for certain things no.
What about the psychosocial part of the Parkinson's, like some people who really are paranoid and all hours of the night?
It helps a lot with those things, and everybody's a little bit different, and then what I tell people is at the end of the day, you're not going to create a new problem. You're not going to hurt somebody, you're not going to make the tremors worse. There's some videos online about, somebody has Parkinson's and they're all shaking and they take the medicine and they stop shaking. I don't see that kind of like miracle, as far as the tremors, but what I do see is, Parkinson's has a lot of very disturbed sleep and messed up sleep and just stress. It helps with that a whole lot. It doesn't change the hallucinations, but it's kind of like, yep, there's my hallucination right there. It doesn't bother me so much. I can still get through my day and deal with people, and I don't have this constant,
So they're not under the cabinets wrapping the pipes because, it's going to flood the house and, the bombs are outside and things like that.
Not as aggressively. It's still there, but not as like, I've got to do it right, I've got to save the day, and, so something that doesn't exist. So it's just, it quiets the the signals. So with that condition, it's not a miracle, but it does help take some of the severity off. And again, some people are really horribly, suffering. So less than that is an improvement and worth it. So, am I running out of time?
All right, you guys.
Good stuff.
Great.
It was good stuff. Thank you very much. Okay, you guys, next month, we are having a very special